Hi, Cam. Welcome to the CoronaMama Zoom Room. How are you?
I'm doing very well. How are you doing, Angeline?
I'm great. Yeah. So thank you so much for being here. Will you introduce yourself and tell us what you do?
Yeah, absolutely. Thanks for having me on the show. By the way, I was really impressed with what you've been doing. So, as she said, my name's Cam. I'm a PA at Minit Medical Urgent Care on Maui. I've been a PA for the past 7 years. I've been at Minit Med for the past 6 years. And yeah, so you might have seen me before at the Lahaina, Kihei, or Kahului locations. And more recently, we've had more of a web presence doing telemedicine.
And that's how I met you. You were the person that appeared on the screen when I had to try to apply for a test. And I have to say that the reason why I asked you to come on here was because I felt so comfortable with you. I felt so taken care of. And I didn't expect that. I just expected like this really clinical, very like impersonal, dry, like, okay, your test, da, 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 kind of experience. Um, but I realized that it takes skill to do what you do, to really help people to not just get tests, but to really understand what's going on so you can help them. So, tell me about like how, I guess, how that is for you when you're in that position and you're seeing all these people and what people need to know about that.
Yeah, absolutely. Thanks for the compliments. It was, nice speaking with you as well. But as they sometimes say in medicine, 90% of the diagnosis is just, talking to the patient. And that, is even more true with telemedicine. It's probably more like, I guess 100% of the diagnosis, it seems. But yeah, you really have to, take your time and facilitate conversation with them.
So what I was thinking was that there's a lot of fear around somebody coming onto a call and thinking like the screen is going to pop up and somebody's going to be really like, I don't know, somebody I don't know, a doctor, and ask me questions. And so what is that like for you when you're on the other side of the screen?
Yeah, it's like I was saying, in medicine, they say that 90% of the diagnosis is talking to the patient and getting the history. So it's really just about getting comfortable and kind of building a small relationship with the person that you're talking with and trying to figure out, what's going on with them, getting the facts and kind of organizing, what's been going on when you're talking to them is really, really important. And just sticking to, yeah, the things that you can really hone in on, and then going from there.
And if you can get the information when somebody's not fearful, then it really helps them as the patient to be able to move forward in however they need to do, right?
Yeah, absolutely.
So tell us what you're seeing as far as, you are right there seeing all the people who need to get tested, calling up. I believe cases are rising right now. What's happening right now in our community?
Yeah, great question. So everybody, sees the numbers as they come out every day. What really is going on is, Maui and Hawaii in general kind of did really well, and then also didn't have the case numbers rise early on. So everybody was, when the fear was really rising during the early parts of the pandemic, the numbers weren't really here yet. So things started to lax off, which is understandable. And then the cases have, risen the past, week or so. Definitely more on Oahu than Maui. I'd say Maui is more characterized by clusters. We're definitely seeing some communal spread, most of them being linked to large gatherings. There's definitely, some related to travel that's going to be cut down here shortly due to the, the extension of the travel bans and the inter-island, quarantine measures. But the majority of cases, like I was saying on Maui, are linked to clusters so far. There's not a whole lot of kind of random by chance community spread, just people passing the grocery store. It's usually related to a group of people meeting, or it's related to a certain workplace, or someone living with somebody else. So that's what we're seeing in terms of cases. Maui's cases, I think we had 12 yesterday. Haven't seen the numbers for today yet. So we're still at a point where things can be managed. Definitely the time to step up measures and be a little bit more adamant about what we're doing, and take the extra measures. In terms of at the clinic, we're definitely, testing as many people as we can that either meet criteria or have had an exposure or who have symptoms. Clinical Labs of Hawaii has been, a huge teammate in this. They've really stepped up the testing capacity to, allow us to really contain these outbreaks, and identify, anybody that's potentially been around these areas and really try and contain that. So that's been a huge part. I'm really thankful to Clinical Labs. As for the clinic, things have, from an urgent care perspective, the clinic has been actually less busy, because what we've done is separate the COVID testing side of things from the clinic side of things. So anybody that potentially has had an exposure or has an acute upper respiratory infection, or really any acute, systemic infection, that's, well enough to be seen outside, we're screening them via telemedicine, and doing any indicated COVID tests outside the building. So what we've done is separated the COVID part of it from the urgent care, so that we can still see people safely inside the clinic, whether it's, for work-related injuries or sports-related injuries, physicals, anything like that. So we're trying to, do that essentially, as safe as possible, probably safer than, before COVID, because there's not very, really anybody inside the clinic that's sick. And we're having extra staff that's doing the testing, specifically for testing, and they're doing it, like I said, in designated areas outside the clinic, or at some of our locations in designated areas of the parking lot. So hopefully that kind of alleviates some people's, fear in terms of seeking medical care. We're still happy to see people via telemedicine. If you're not, not sure if you need to come into the clinic. Some patients, like small children, pediatrics, still want to see them in person for a non-COVID related issue, because you really need to take a good look at them. But that's what we're seeing in terms of kind of how the urgent cares are being run and the cases currently on Maui. And we can, go into more detail about, the testing later in the conversation.
Well, I just want to say that I felt extremely happy and safe when you told me that I didn't have to go into the building, because my first, of course, on our minds are like, I'm going to the place where there's all these people who had COVID or might have COVID, So I felt relieved when you said, oh, no, you just go around to the back of the building. You don't have to go in. And when I actually went there, there wasn't anyone else there. And then once we got, we're testing, there were a couple people in line, but they were very social distance. It was super windy that day, so I felt like, oh, there's so much air that nothing can actually hurt us, or we're not exposed. And I think that's important for people to know, that it's a really non-scary situation. It's a really easy, fast, first you do the televisit, and that is so reassuring. You can ask all these questions. I know we had a lot of questions, all these questions. And then when you go for the actual test, you don't even go into the building. So I just felt like you guys have thought out all of this to really allay our fears too, to really take care of us and to make sure that we're getting the service that we need in the way that we need it. Not so much for your convenience, because it's harder for you guys to do it this way, but you've thought about all these things where it is super simple. You can fill out all your information online before you get there. All those things were really, I thought, well done, so that we, as the person who's scared, really literally, we're scared, bringing our kids, we're scared. It's like you just feel so much better. Like, okay, they've got us. They've got it. They have our back. We're going to be okay. And so that. But I also wanted to go back to something that you said about um, the way that people are spreading it or not spreading it, and it's very clear to you because you're talking to the people who have to come to get tested. It's very clear to you that it is really not a casual thing, and that's not surprising to me, but I think people need to realize that it's not really just like, have you had any from, oh, I think I was in the grocery store? I mean, probably not, right?
Yeah, that's a good question. I'm sure there's been, you know, a handful of cases that have just been, wow, I'm not exactly sure how I got it, but I was, at this place. It's definitely possible, but yeah, the vast majority are people that were around, say, in a group gathering, and then later, after the fact, they find out, that one of these people was positive, and then some of them will go on to become positive, themselves. And that's not to single out all the time, that one person that was at that group gathering. I mean, because there's some incubation time, and the people that are going to these. I'm not encouraging group gatherings, but as we'll talk about, not everybody can stay in quarantine isolation forever. So there's going to be some interactions between people. But the problem is there's potential spread between people before they have symptoms, or what we call the pre-symptomatic or the asymptomatic spread, where they don't know they have it and they're around other people and they accidentally or unknowingly pass it on. So that's the really tough, sneaky part about COVID. But back to your question, yeah, it's not so much a random thing where, wow, I have no idea how I got it. It's usually, oh yeah, I flew to another island and I was doing this, and oh yeah, I heard someone there was positive, henceforth. Or maybe I was playing, a game of, whatever, a pickup game with some other people and somebody found out they were positive. Or it's usually what we call a, the CDC terms, a close contact. That means you're within 6 feet of somebody for at least 15 minutes. And while it could take less than that, that's what we're terming that significant contact. That's when there's a reasonably high chance that the virus is either being spread through the respiratory droplets, or you're exchanging things and you're touching it and it enters then into either your eyes or your nose, and you get the infection. So that leads us to another thing. The social distancing and mask wearing is important. It seems like a simple thing, but it's also a scientific thing, because if you were to be able to see everything that comes out of people's mouths when they talk or breathe or cough, there is that, because of the virus, the size of it or the mass that it has, there really is that kind of 6 feet plus or minus a few feet with coughs or the wind. There really is that 6 feet that the virus can spread. So when you put that mask on, it protects other people. It protects you a little bit, but it's more about protecting other people. So if everybody, that's why it's really important where everybody is all in. If just half of the people do it, then it's not going to be effective. But I think Hawaii has been pretty good. I think really good teamwork, cooperation, just on terms of all the community members, in terms of people wearing their masks. It's
I
been
think there's
really
an aloha
helpful.
spirit that people
Yeah,
have, really more so than maybe the mainland, I'm thinking.
right. And then, yeah, just to continue that, mask, people have heard that numerous times. Hand washing, super important. Especially soap, alcohol, those things break down the surface of the virus. So, that you're killing the virus right there. You can, stick it to it. So that's really important. Hopefully that'll continue beyond COVID. Really,
Right.
I'm a proponent of hygiene. And
Are
we talked
there
about the social
fewer,
distance.
oh,
Go ahead.
are there fewer other viruses going around because we've been so like good at
Yes, absolutely. I haven't heard of any officially extinct yet, unfortunately. But yeah, there's definitely been less, I'd say, infections in general. Yeah, just less people mingling. If maybe we can knock out another virus in the meantime, that would be
wouldn't that be
an
great?
excellent byproduct. Yeah.
Mm-hmm. But yeah, so I was just thinking like when you're talking about the mask wearing that I'm actually noticing, and probably a lot of people are too, that I see the spray happening now that I'm super conscious. I never did before, but when I look at people and they're talking and when they're really like emphatic about something, I literally see the droplets coming out. And that's kind of scary, like, and this was a little bit prior to when like we were mandatory mask wearing. So it is really like if you are around somebody, just look because that will like prove, I think it's like visual proof to you that if somebody has a mask on, that spray is not coming out and then becoming airborne with the wind. Like that's where the 6 feet thing comes into play, because I don't think people think about, they're like, well, why 6 feet? But look, the next time you see somebody, you'll see these droplets like coming out. And then wherever you are, whether you're outside or in air conditioning, that air can like just waft it in many different directions. So I just had to say that because what the visual came to my mind when you said that. And I think people hear over and over mask wearing in 6 feet. And it's almost like a mantra that you sort of ignore, not ignore, but becomes like so cliche. You're like, yeah, yeah, yeah. So I just thought I would put that visual into people's minds of,
Right. Yeah. I mean, clearly you have superb vision. I mean, I can't say I can always see that, but that's incredible.
well,
But
maybe now you
um,
will.
yeah, I would really say that they have studied it. They are able to see those things. You could probably Google a picture, CDC respiratory droplets, and when it's a photograph, not a photograph, but it's a picture, and you see these little dots in this mass that go out that 6 feet, and it's just a picture, but it is a representation of what they have seen. So if you're picturing that, then that kind of puts it in your head as to why you're doing what you're doing. Because if you have no idea why you're wearing a mask, or why you're washing a hand, then it is hard. I would agree. It's hard to do things for me when I have no idea why I'm doing it. But when it's a good idea, it's a lot easier. Like we talked about with soap and alcohol. Some people, you get it in your head like soap, it's just soap. It doesn't really work. But when you think about it, and the virus has, a lipid membrane, and it can actually break down the membrane of the virus, as does alcohol. So, a sufficient percentage, usually at least 60%, will break down the virus. So when you know those things, it's like, okay, I did that. I know that works. And then you can move on and feel a little bit safer about what you're doing.
I didn't even realize that. I thought it like slipped off because of the soap. So thank you for that. Like knowing that it actually breaks the membrane and like disrupts the cell and kills it.
Hmm.
That's huge. Thank you.
Yeah, I mean, it's not going to 100% kill all, and don't drink soap, not or alcohol. I'm not advocating that, but yeah, it actually does help break down some of the virus, and as you said, as a surfactant, it gets it off your hands. So yeah, you got the
Okay.
other half of it.
Okay. I want to talk about calculated risks and risky behavior because I think that's part of what is causing the spread. And as you said, there's people who are, you know, like taking these calculated risks and saying, okay, I'm just going to go to this party once. Or like, or I think like, so tell me about when you see people or just your general idea about calculated risk and maybe what you're seeing, the rationale that goes through people's minds of who have now had to get tested.
Yeah, absolutely. I think it's one of those things that's imperative to think about, before rather than after the fact. So it really comes down to everybody self-assessing, before they're going out and being around other people. Have I had any symptoms? Have I been around somebody that I, is know is being tested or found out they're positive? So just, things that you already think about in the back of your head, but just thinking about those things before you're going out. Yeah, and as you go out and are around other people, I think it's important to have not not be spreading yourself out too far where, when DOH calls you after you find out you're positive and you're telling them, well, I was at this beach party and then I was, at this grocery store, and, don't spread yourself out all over the place, where you've been around 1,000 people. I think it's okay to be around a select group of people. I think it's great to have, what I or other people call quarantines. Not that you're necessarily quarantining, but groups of people where you're, those are kind of your social group where you're kind of all holding yourself accountable to, what you're doing, and where you feel a little bit safer being around those people. I think when you're around maybe new groups of people or people that you don't know as well, you should continue to wear masks and isolate and be, a little bit extra careful until you know a little bit more about their movements and things like that. And so the calculated risks is really just, kind of what we alluded to, and not going out on a whim and being random and going all over the place. It's just kind of taking some precautionary measures like we've already covered. So masking, hygiene, social distancing, being careful with the people you're being around. And I think taking those things into account, when you do all those things, then you can feel a little bit better about it. You're a lower risk. You're, lower risk for yourself and for other people. So kind of, the more and you think about, the less chances that, there is for failure or breakthrough.
What I'm wondering about are there certain like value systems or judgment calls that you're seeing repeatedly over and over that come in?
No, I can't say there's any one thing. I don't know all the case specifics, on Oahu. The DOH, they're doing the majority of the contact tracing and really finding out, where all these people have been and what they're doing. So I only, know the specifics of, the people that we've talked to at our clinic. I can't say there's any one thing that people are, doing. I'm like, oh, you shouldn't have done that. Other than, I have heard a few instances where, someone will present needing a test because they were around somebody that was positive. And I questioned them, and it turns out that the person that became positive had that test pending, while they were around this other person. So what that means is they went and got a test, and then while waiting for the results, they were, out doing, either working or around other people. So essentially, if you are being tested, you think you need to be tested, or you've been told that you need to be tested, and you're waiting on a result, you have to quarantine. Because I know of at least 2 or 3 where the person that was exposed because the other person, went out while they were waiting on a result. So yeah, hopefully people are getting, instructions when they're tested. I know we give, paper handout anytime we test somebody that has all this written down on it, because obviously there's a lot of information to take in. But that's one thing that I'd like people to remember is just if you're waiting on a test, wait a few days to get the test result, and the clearance by your medical provider before you go out.
That is huge. I mean, all those people that actually thought they might have it. I mean, that's why you go to get tested, because you think you might have it. And if they might have it, then they should act as if they actually have it so that they're not
Right.
spreading it. And that's what my husband did. He thought he was exposed. So he right away quarantined. and waited his 14 days and actually had another test done, because I heard that hospital workers do 3 tests just to be sure. So I said, well, maybe you might want to do another one. And so then he waited till like more than his 14 days. That second test result came back negative, just to be sure. And I mean, he's super, super responsible, but if we all did that, then we could be saving that exponential spread from happening, just to be sure, right?
Right. Yeah, because I mean, we all know this is a huge bummer, to be going through all this. It's, been a huge upset for, a lot of people, some people more than others, absolutely. So yeah, every time the numbers go up or somebody messes up, it really does affect everybody, whether it's school or work or, in big picture, inter-island quarantine, travel restrictions. So yeah, the more likely, the better we do to get our numbers down, then the sooner we can get back to things. So yeah, everybody has to come together kind of on that. And, the hard thing will be that, there will be more cases and there will be clusters. So it's not going to just go away. So we just have to, have all the provisions in place and know how to, respond when that happens.
I think of it as, I just came up with this idea now. You know how there's the idea of the carbon footprint? Well, there's also the COVID footprint. Like, you're actually like walking around, and if you can minimize your COVID footprint, then there will be less spread. So we have to think about minimizing our movements as the COVID footprint. I just like that.
That's great. I mean, yeah, you should patent that, or if it hasn't already taken, brand that. No, I think that's a great way to look at it. Carbon and COVID. I think we should continue to look at the carbon footprint too. But yeah, especially right now, COVID, absolutely. I think that's a great idea.
Well, it'd be great for you to walk us through, like, what happens when someone gets infected. Like, what are the steps that they really should take, and when they get it, or when they think they get exposure.
Right. Yeah, absolutely. And we can just touch real quickly as well on symptoms, or how do you know if you have it. So classically, CDC has a list of symptoms as well. They even have an online questionnaire checker. You can actually go online to the CDC website, and there's a little box that pops up, and you can go through and find out if you need to be tested. But classically, it's a virus that causes a respiratory infection. So you might start with a sore throat, feeling fatigued, feeling achy, might have a little bit of nasal congestion or headache. So those are usually the first symptoms. So anytime you feel something like that coming on, I think it's okay to take the first 24 hours and just quarantine and see what's going on. But usually, when something's off. People, especially right now, people are really observant to what's happening with their body. So look out for those symptoms. It can progress to fever, cough, trouble breathing. We are seeing additionally some symptoms of GI symptoms, so diarrhea, GI upset, nausea, vomiting on occasion, as well as some symptoms of loss of smell, or what we call anosmia, that can affect taste. So those are all symptoms that you should be on the lookout for. So say you either have those, or you find out that you were in close contact, or you were around this person, you're not sure if it's a significant contact. The next thing you should do is get a consultation for a test. So you can absolutely come to Minit Medical. You can go to our website, minitmed.com. It's very straightforward on the main page there. You can pull that up and set up the visit. It'll take care of all your registration online. It's pretty straightforward, pretty easy. So you'll get a visit set up, and there's some. If you go to the website, it's pretty self-explanatory. It'll take your insurance and things like that, and then it'll ask you to schedule. You'll just schedule a telemedicine visit with one of the providers at our clinic. And then it'll kind of be like what we're doing right now. It's either on your phone or your computer. You just have to have an internet connection, preferably Wi-Fi. and we'll talk to you, figure out what's going on, document your symptoms, and then determine if you need a test. If you have symptoms, most likely you need a test. If it's an exposure, we'll determine if it's a significant exposure or if it warrants testing. And then we'll get you set up for testing, which we'll do right when we're talking to you. We'll schedule that. And we have 3 locations around the island. We also do intermittently some drive-through testing. Those will be advertised either on our website or Facebook, at the dates that those occur. When you go through to do the test, usually we're getting them scheduled same day. If it's later in the day, maybe next day or 2 days out. You'll just come to the clinic, and depending on which clinic it is, either you'll walk around to a designated area outside. A nurse dressed in their protective equipment will come out and swab you, and then you leave. They will also document some of your vital signs quickly. And some other clinics, the nurses will come out actually to your car and swab you from the car. And then you leave and you go home and you quarantine until we give you your test result, which is on average taking around 72 hours. Sometimes 24 hours, sometimes a little over the 72-hour mark, subject to change just because of it. It depends on the load of the laboratory. As cases pick up, the burden increases, things could slow down a little bit. But right now, most or all the tests are being run on Maui, so we're getting pretty quick turnaround time. So you're not home quarantining for 10 days just waiting for a negative result. Usually it's pretty quick, and we will call you as soon as the result comes in. So we get those first thing every morning, and we will call you as soon as it results in. And at that time, we will either, depending on your situation, either you will need to finish out quarantine or you'll be released. It's really highly dependent on if you've had symptoms, your exposure, and whether or not you will require quarantine. Because as we can, go into next, a negative test doesn't 100% of the time clear you. So
a negative test does not clear you.
Yeah, and let me expand on that instead of just leaving a cliffhanger, right? So
exactly.
I had to reposition. So so we can go into testing. So there's three main tests and then 2 divisions of the test. So one division would be a diagnostic test. That would be to find out if you have the virus. The other type of test is an antibody test. And that's primarily, one, to see if you have antibody, but the main reason is usually to see if you've been exposed to the virus. Antibody test isn't really used as a diagnostic test just because of the way that the body synthesizes and makes antibodies, which are proteins. It's more of a marker of past infection because we're checking for IgG. So anyways, when you're coming
infectious at the time, you don't, if you have antibodies, maybe you're not infectious.
Possibly. The problem is, so antibodies, the IgG can be developed somewhere around, 10 to maybe more like 12 to 30 days after you're exposed. So at that, right when that IgG or the antibody is made, you could still be infectious. So people that do have a positive antibody, right now we are still then, going back and doing the actual diagnostic test. The antibody test is primarily, it's good for what we call, data purposes or epidemiology, kind of identifying how many people have antibodies, how many people have been exposed. Right now, we're still monitoring the situation. It's looking like antibodies last for about 3 months in most people, maybe longer, maybe shorter. There's other parts of the immune system that, we don't need to go into that still provide your body some immunity, but the antibody, that's what that's going to show you. So the diagnostic tests, those are either PCR, which is polymerase chain reaction, and that's a nasal swab, in your nasal mucosa, either nasal or nasopharyngeal. And there's also a rapid antigen test. The rapid antigen test is actually looking for some of the proteins on the virus. So if you have a positive antigen test, you can pretty much guarantee that you have the infection. The PCR is using the virus's, RNA and expanding that through a chemical process to confirm that you have it. So both of them are pretty surefire ways for confirming that you have the test. The antigen test doesn't have the level of what we call sensitivity or ability to rule out the infection. So the antigen test is what we call the rapid test or the rapid antigen test. The results will come back a little bit quicker. Problem is hard to 100% count on that for ruling out the infection. So PCR, that's primarily what we do at our clinic is the PCR. We can also order the antibody test. We're not doing the antigen currently, but that could change. The PCR is the nasopharyngeal test. We send that to the lab. They run it on a fancy machine to look for the RNA of the virus. And so that's very specific and sensitive. So if that's negative, you can, almost count on that for the fact that you didn't have the virus in a sufficient quantity when they tested you. The problem with testing is timing. So whenever you're exposed to a virus, there's the exposure where the virus goes from, one person to you. And remind me to come back to this later about how you catch a virus. I think that's, okay, important or at least interesting to talk about. But when you get the virus, if you were to maybe swab, what if it went in your left nostril and you swabbed the right nostril or, something like that? The virus hasn't replicated. It's not all within your mucosa. So that's why time,
as soon as you get it.
Yeah. So the virus comes in, it takes about 10 minutes for a virus to enter into the cell. It uses, you've probably heard you've probably heard the term spike protein. These little spike projections on the envelope of the virus attach onto your cells, get into your cells, use your cell's machinery, replicate, and then it goes on to the next cell. So I don't want to get lost in too much detail. I don't want your eyes to gloss over.
But it's interesting. Though. It is these things have to attach.
Yeah, it's some really all really smart scientists out there that I'm just relaying their information to you. But the virus has to replicate. So the timing is important because of the incubation period. So there's a time from exposure to developing symptoms, which unfortunately in COVID causes a lot of the problems because you maybe were exposed 5 days ago and you have no symptoms until tomorrow. So the vast majority of people become symptomatic in between day 5 and day 6, but it can go all the way to day 14. So that's where the bummer 2-week quarantine comes into play. That's where the bummer negative test 2 days after exposure doesn't completely exclude you from quarantine.
What's the highest spike time of infection, like infection rate, where somebody can be spreading as much more viral load, I guess the term is? Where in the timeline is that?
Yeah, great question. So it's going to be the 24 hours, about 24 hours before you develop symptoms, and then extending probably 2 to 3 days after you develop symptoms. That's the period of highest infectivity.
And then what about asymptomatic?
Asymptomatic is tough because it's hard to identify when they got the virus, and because they're asymptomatic. So yeah, asymptomatic is really tough, and that's things that we're still studying to learn and know how many people are actually asymptomatic, because there definitely are some asymptomatic, but kind of what we talked about before in doing that self-check, I think some of the asymptomatic are either pre-symptomatic or just very mild symptoms that people just maybe shrug off. So if you do have that cough or scratchy throat, but then it goes away the next day, there's a possibility that could have been your COVID illness and it was just really mild for you. So you really have to take note of any of those symptoms that are going on in your body.
And then there's some people who get a scratchy throat like me, and I'm like, no, do I have COVID? I hope not. And then
I
I
know.
tested negative, so I didn't. But, there's those thoughts. So we have to, I guess, pay attention, yet not freak out.
Right. And so that's part of what we do with the telemedicine, because yeah, a lot of people will, get a headache or whatever. There's tons of other reasons. There's still the rest of medicine that still occurs, problems that happen with the body. And there's still people that get headaches, sore throats for other reasons. So part of that telemedicine is really talking to people and seeing, what's going on and seeing if the symptoms meet the criteria for testing. We're not turning people away because, oh, you didn't meet this criteria. It's not all about criteria, but it's at least kind of getting the full picture to make that educated decision.
When people come to you, what are the main questions? You see a lot of people that come to you in the telemedicine visit. So, what are people most confused about, I guess, or
I
wondering?
would, right, right. I mean, I think there's a lot of questions about if you need to be tested. Um, there's questions about whether or not, they need to quarantine when we're, travelers. There's questions about wanting to get a test to exclude them from quarantine. And there's questions about, which kind of test to get. So I think we covered some of those. I can go over briefly kind of why you would need to get tested. So we can talk a little bit about direct versus indirect contact. So direct is pretty straightforward. If you had a direct contact with someone that you find out to be COVID positive, that's pretty easy. You should schedule a telemedicine and speak to a provider and probably get scheduled for a test. There might be some very rare instances where you were wearing appropriate PPE and is deemed a non-risk exposure. But in general, if you've had any exposure with someone that is confirmed to be positive, that's a reason for a test. Now, indirect contacts, if say, your brother or sister was around somebody who turned out to be positive, and then you were around your brother or sister maybe a few days later. So that's what we call an indirect contact. That does not need to have a test. If you're an indirect exposure, you do not need to necessarily have a test unless the person that, say, your brother becomes positive, then you become a positive, a direct contact. So it's important to maintain communication with those people who were around positive people who you were around, with them, because if they become positive, that completely changes your situation, and you become, a contact who might need to be tested and quarantined. In regards to quarantine, when does that start and end? It starts the day after your last exposure to someone who is a confirmed positive. So if you were around somebody 3 days ago who calls you and lets you know that they tested positive, your quarantine starts 2 days ago. So you have 10 more days to go essentially. So I'm not expecting people to memorize that, but just to kind of give them a heads up as to what might come up during the call. Another question is what type of test, and we already covered that, diagnostic versus antibody. Another question is about quarantining, living with other people, and I know you went through that, and
Yep.
and that's tough because most people's houses aren't designed to have a quarantine wing, in the house.
We fortunately
So
had one. It was our
right.
media
Well,
room with its own bathroom, so became the quarantine wing.
yeah. So it's tough. It's hard. People asking those questions, and I have to say, well, yeah, you have to, one, do your best. If there's no option, whatsoever, say for whatever reason you're living in a room with 8 other people, then you could reach out to the Department of Health, and they might be able to set up another, some sort of a quarantine area for you. I'm not sure, but in general, you're going to want to, and here's why it's important that you quarantine separately from someone that's positive in your house. So say, for example, say that I was positive, then I would need to quarantine. And, my wife would also have to quarantine because she had exposure. But the importance of separating yourself if you're positive from your family members is that because you're excreting virus, their risk of gathering or obtaining a lot more virus is higher from you or me than it would be from just bumping into somebody at the grocery store. So, I think they looked at this over in Italy and some places in Europe, but actually the people that obtained infections from family members did worse or had more severe infections because they had higher viral loads. Okay. So it's really important to, keep that in mind, and, because you care about your family or friends or people that you're living with, to try and minimize their exposure. And so CDC is a great website that has outlined some measures to take in terms of cleaning, from, what types of cleaners are acceptable, how to separate yourselves, wearing masks and things like that. And then it's just a matter of, fighting off the illness if you have it, or quarantining and getting through that like you experienced.
Mm-hmm. There were so many things I didn't think about, but like, handing him food. I was giving my husband food through our sliding glass door, and someone said, "Well, why aren't you using paper plates?" I'm like, duh. Okay. Like that's a no brainer. I'm so into like not doing a what was it called? One use, single use type thing, that it just didn't occur to me. So, there are things that I guess once you go through it, you can think through what are the things that you can do. Do you have any tips on that?
Yeah. So just think about all the potential high risk areas in your house. So even if you have a small house, with not a lot of area to separate, usually there's more than one bedroom in a house. So obviously the person that needs to quarantine gets that bedroom. Lysol or some other spray or a bleach solution that's been approved to kill coronavirus, I would have that on hand. And high contact areas, so door handles. If you are able to separate bathrooms, have a separate bathroom, that is huge. So cleaning all those high touch areas, whether it's sink handles, door handles, cleaning anything else that you might be in contact with. I realize that there might be situations where, especially if you're quarantining in a house with someone, that person needs to come out of the room to get something or whatever. I would encourage mask wearing in the house when you leave your quarantine area. As for, airflow, yeah, I think keeping the windows open and encouraging fresh air coming in and out, like they say in South Africa, the Cape Doctor, that would be beneficial too. Other things are listed on CDC website for how to, clean and quarantine, best practices.
Yeah, I actually went to Target and opened up the CDC website where there's a link to the EPA approved cleaners. And I took each cleaner and I looked at the number. There's like 2 numbers and a dash and then 4 numbers. And I'm like, okay, is this on the list? And you can type the name of the product or the number in there and it will come up if it's actually approved. And there was one that had an EPA number that was not on the list. So I assume, and I think it was before, so maybe it became not approved after a while. So I think it's really important to actually do the work and like make sure, and you can, I mean, it's right there, but I don't know that people realize that you can input that information and it'll come up on your phone if you have a smartphone, which most people do. And you can do that right in the store. So
right. Absolutely. Yeah. And I know at certain times it was hard to obtain cleaners. or bleach for that matter. But there are some household ways to DIY with bleach. A certain concentration bleach solution absolutely will work. The thing to remember with those cleaners is they need sufficient time to work. So it's not a spray on and wipe off right away. It's a spray on, let it work for at least 2 minutes, or evaporate some, and then you wipe it off. So give the chemicals time to function as they're intended to function, instead of just going through the motions. Don't waste your efforts. So make sure you're doing that. I had kind of spoke earlier about maybe mentioning how you get the virus. So that
Right.
plays into a lot of the things that you're doing too. So mucous membranes are a great entryway for this virus. So it's primarily going to be nose, sometimes mouth, and then a lot of people forget eyes. So it can definitely get in, through your mucous membranes, your conjunctiva, and spread down through the tear ducts into the back of the nose. So don't, just be careful. Don't, do what I'm doing right now. Just be careful to, I shouldn't even say be careful. Just, don't touch your face. Make sure you're washing. Wash your hands frequently. That will go a long way in prevention.
If you get it into your eyes, do you have a certain effect? Like, do they get red, or does something happen right away, or it just goes directly into your nasal and throat, the virus? Is there something?
It's a good question. I haven't seen very, I'd have to look it up and see if there's actually conjunctivitis occurs. But a lot of what happens with the virus is dependent on their specific receptor in the areas of the body they can hold on to. So for COVID, it's the ACE2 receptor, and that's found in specific areas in the back of the nose, back of the throat, and then down in the lungs. And actually, we're finding a lot of other areas in the body as well. I'm not sure about specifics in the eye. That's a great question, but I don't think that you get. No, that's great. I don't think it causes conjunctivitis as far as I'm aware, but that'd be a good thing to look up.
Okay. Well, it doesn't have the ACE receptors there as it does here. So it just probably slides right down. That's my, that's my idea of what happens, at least.
Yeah.
That's not scientific, anyone.
Right. It has to do with, development and endoderm and things like that, where the receptor is, but we don't need to go into that.
Okay. So another thing is, like, when we're talking about quarantine, I was thinking, like, my husband did not go to surf. He did not leave our property. He was super stringent. But what are the thoughts about that? Walking in nature or going to surf, or for your emotional well-being? I saw him like kind of decline because he was like trying to be so good, like, so emotionally it was hard for him. And I think we have to think about emotional well-being as well. So what are the real facts about that?
Yeah, those are good things to bring up as well. Not surfing is, not good for your health. I realize, and tough to do. But I would say surfing in a public, surfing should be kind of off the plate. I think if you're quarantining, or if you're waiting on a test result, or if you're positive, just because 95% of the time you're surfing, you're around other people, for one. Two, if you're sick, surfing's not a great thing to do. You should be resting. Now, as for nature, I think if you have the ability to go into nature, and it's not in a public area, or you're not going to be around other people, if you can go out on your property, I think that's fine. There's beneficial things about being in nature, immune stimulation, getting sunlight, that are important for your health. Can help you fight infections. So if you can do it in a manner that you're not going to be around other people, I would say you shouldn't go to Ho'okipa and surf. You shouldn't go to Baldwin Beach Park. But if you have some property that you can walk on, and if you're in an apartment, that is tough. You could go out, you could look out your window and maybe go out on the porch. If there's not people around, just don't touch anything. But you really have to follow quarantine guidelines. But there are those intangible side effects of being stuck inside. So you do have to do some things to mediate those. But if you're symptomatic and you're coughing and you're in the middle, you're in the heat of it, yeah, really have to do your best, or, you really have to not be around other people.
Yeah, I think being responsible and just holding out for those 14 days, and it's doable. It's not easy, but it's doable. I think
Right.
there's a lot of moms here and dads probably who are thinking, what about children? Do you have any particular thoughts around children, school teachers, anything that we should do to keep safe? I don't know if there's anything specific that you have to talk about with that.
Not too specific. I mean, they unfortunately have to follow the same rules as adults for isolation, hygiene measures, things like that. Obviously, younger kids aren't going to fully grasp the concept. And so if they are, playing, like maybe we'd mentioned earlier, having those quarantines or those groups that, you're a little bit closer with. So if there is an exposure, it's easy to communicate that quickly and effectively. Otherwise, schools, I know they have a full, they're having to develop, uh, exposure plans and ways to mitigate this. So, they're with the distance learning, and I would just follow that. Or if you're in a homeschool group, that's fine. But otherwise, yeah, they have to follow the same, isolation and distancing and hygiene measures that adults do.
Okay, sorry, that was like probably not like a question that falls under your.
Yeah, I would
I'll
defer
probably
to
I'll
maybe a
probably cut that out.
pediatrician.
Yeah, I'll cut that part out. I'm thinking that
Okay.
that didn't really have anything to do with what you do. But what does is, oh yeah. So I was wondering about sunlight. We're told that sunlight will kill the virus. And so I throw my mask after I use it after being in the store right on top of the dashboard. And now I'm reading that they're saying, well, we can't be certain.
Right. Yeah. So I would agree that sunlight or heat has been shown to denature and deactivate the virus. I think what they're going for is that, well, one, with sunlight, you can't clean both sides of it at the same time. And there might be internal parts of the mask that capture virus that the sun's not going to get to. So I think that's what they're going for. So I think, putting it in the sun is better than nothing. But if you've been out around other people, you should still wash it. So for cloth masks, that's either soaking in a bleach solution or just using your normal washer and dryer. There's nothing wrong with the sun. Just, yeah, I don't think you should 100% count on it for those reasons.
Okay, that clears that up. Um, Sorry, I'm just looking at these different different questions. And of course,
We can talk about in regards to testing. How do you get tested? What if you don't have insurance? All those things.
oh yeah,
That's probably a question that we get asked a lot. So,
okay.
all the major insurances obviously will cover it as long as you have a reason to be tested, like an exposure or symptoms, or those would be the two primary reasons. Insurance will not cover it if you just, want to be tested for your peace of mind, just because there's no point in testing you if you have no symptoms or exposure, because what if the very next day you're around somebody, and then you need to be tested again. So if you don't have insurance, there is a government program that is covering tests if you don't have insurance. But just the same restrictions apply. You have to have an indication for the test, whether that's an exposure or symptoms. So you can follow the exact same procedure for scheduling a telemedicine visit. Just go to our website, and I think there's a question in, where you would mark that you don't have insurance. But basically the whole thing is, we wouldn't, just because somebody doesn't have insurance, we wouldn't want them to, avoid getting tested or a visit for fear of cost or something like that. So like I said, the same criteria apply for who gets a test to both people that have insurance and don't have insurance. and I believe most insurances are covering all things related to COVID testing if it's indicated. If you need testing for travel or for work or something like that, it's probably not going to be covered by insurance. You'd have to check with your individual insurance carrier. But I think that covers that part of it.
Yeah, that's really important because there are people who don't have insurance and they might think, oh, I can't get tested. I don't have money to pay for it. So that's really an important thing to know. So what are most people worried about that they actually shouldn't be worrying about?
Yeah, I think a lot of people are worried about the embarrassment or being scared to tell other people that they have COVID just because it's a, it's a new thing. It's not like saying that, oh yeah, I have a cold. There's a lot of extra fluff around COVID right now. So yeah, I would tell people not to be afraid. I mean, look at the Johns Hopkins coronavirus map. I mean, 5 million something people in the United States have had it. So do not be afraid or let that dictate not getting a test or not talking to a doctor. Don't be afraid of missing work or school, saying, I have a cough, I have a low, fever, but it's low. I'm gonna see how it goes. Don't be afraid to miss work or something like that, because it's easy to do that because people have things to do. They're busy. People, important things to do. But if you go to work and you're infected and you infect other people, that creates a whole chain reaction. Whereas if you just suck it up, do the telemedicine and get the test beforehand, then you can avoid a lot of those problems. So yeah, don't be afraid about the stigma of it, because so many other people have had it. It's so easy. It's very contagious. It might not necessarily be anything that you did wrong. Don't be afraid about, calling into work and say, hey, sorry, but I'm waiting on a COVID test. Can I work from home today if you're not already? So those would be the main things that I would like to relay.
So don't be afraid to call for a telemedicine visit if you're feeling some of those symptoms like fatigue and sore throat and maybe loss of smell, or is there a line to draw? Because you don't want a zillion people calling you, but then you also don't want people to go without calling and asking a telemedicine doctor.
Right. Yeah. So just, know your body. If you feel something's wrong, and check your symptoms, or if you've had any exposure or concerning exposure, yeah, just keep it simple. Those would be the main things that to think about. The other thing would be if, you've been diagnosed and you're not sure about, you have COVID and you're not sure about how things are going, you're worried they're getting worse. Those would be the most important ones that I would like people to call us right away. If your cough's getting worse, you're having any trouble breathing, anything like that, call right away. If it's bad, of course, go to the emergency department. And before you go to the emergency department, I think it's really important to call them, let them know ahead of time. They have protocols for entering the emergency room, and I believe they have a tent area outside. Make sure you bring your mask, with you before you go anywhere, like, emergency department, if you are sick as well. And then the other thing that I would like to touch on is don't be afraid to seek, medical care for other issues. Like we said earlier, there's still medical problems still happen outside of COVID. Heart attacks, strokes, diabetes, high blood pressure, those things are still all happening, including mental health. So, and it might be more difficult to see your primary care doctor, but we're happy to see you via telemedicine if your primary care doctor doesn't have that, and, maybe give you a temporary, blood pressure medication refill until you can see your doctor. So things like that. Don't wait too long because you're scared of seeking medical care, because you're scared of getting COVID. Make sure you're still taking care of yourself and doing what's right for you. If there's any problems at home, you're really having a tough time with the quarantine, whether it's mental health or physical health, give us a call, or we can direct you in the right direction if you need to, speak with somebody else.
So if anybody is having issues like during quarantine or like, can they call you or any other types of things that they're a little bit worried about or concerned about and not sure about?
Yeah, we're still available for, medical consultations via telemedicine that are not COVID related. You can still come into the clinic. There's a whole pre-screening procedure, and you have to wear a mask. Visitors or, other people that aren't seeking treatment can't come into the clinic with you. But, our clinic is still open, clean, and, we're still happy to see people for any sort of medical, related problem or injury.
Okay.
Not happy that you have it, but, happy
Right.
to see you.
Of course. I think we've covered quite a bit here. Is there anything else that
Yeah.
you think people should know, parents and specifically?
No, I just want to, if you know somebody that works at the hospital or clinical labs, make sure you tell them thank you for everything that they've done. I want to say thank you to, all the community members, including you, Angeline. It's because of everybody coming together, that things aren't out of control, So yeah, I wanted to say thank you to everybody there, as well as the clinic owners, Amanda and Justin Prouty, for everything that they're trying to do to support this process through the clinic as well. So, and thanks for having me, Angeline.
Thank you for all you do and the patience that you have with every single person and the compassion and the way that you go about your, I guess you would call it bedside telemedicine manner. It is really awesome, and we need more people like you who really know how to deal with the public in the way that you do. You're on the front line even though you're behind a screen, and it takes a lot of yourself to bring to the public every day that you work. So I appreciate you a lot. Thanks.
Well, thank you again. It's been an honor, and I hope to see you again in the future.
Yeah, me too. So where are you zooming off to now?
I am zooming off to another call after this, and then hopefully some lunch or early dinner.
Sounds good. No kiting today?
Not today, unfortunately.
Oh, the wind's no good.
But, right.
Or not enough time, one or the other.
Not enough time today, but another day I would love to be out there.
All right. Well, take care. Nice to see you again.
All right, you as well. Aloha.
All right. Aloha.